I still don't quite feel like I'm ready to jump in and start on July 1st. The nurses expect you to be the doctor. The patients expect you to be the doctor. Your colleagues expect you to be the doctor. If I run into a problem, I worry there won't be anybody else to run it by or help me think it through. And I know that situation is probably going to happen on July 1st, or if not, July 2nd or July 3rd.
Trainees must squeeze every ounce of learning from clinical experiences. Given the rapidly changing hospital environment, it is essential to explicitly design integrated, meaningful clinical experiences to prepare trainees for independent practice. Hello, I'm Medina Khaled, and I am pleased to have this opportunity to present to you Night-OnCall, a program that uses the EPAs as the standard to assess and address transitioning medical students' preparedness for residency. This work began with WISE-MD, which we launched in 2004 to provide students with critical exposure to the full range of clinical cases during their surgical clerkship. In 2014, in response to an increasing concern about students' readiness for practice, our team created WISE-OnCall. WISE-OnCall is targeted at enhancing the ability of novices to address common clinical coverage issues. In 2016, we designed Night-OnCall to both enable learners to practice and educators to measure clinical reasoning skills in a series of simulated, situated clinical events structured together with WISE-OnCall. In 2014, the Association of American Medical Colleges challenged medical educators to ensure that new interns entering residency demonstrate competence in 13 core entrustable professional activities. Night-OnCall is our recent initiative to help educators better understand clinical competence. Night-OnCall is also the first phase in our study of situated mixed modality experiences, where the trainee is exposed to deliberately integrated experiences that are anchored in a common authentic clinical problem and range in the instructional design features, offering the trainee diverse, meaningful clinical learning experiences. Night-OnCall is a 4-hour simulation of the on-call experience. The trainee starts his Night-OnCall.
Learners, welcome to your Night-OnCall.
He first returns a page from a nurse. Then he is given an opportunity to ask the nurse clarifying questions before entering the room to assess his first patient. The trainee then interacts with the patient and discusses lab values, ECGs, imaging results, and simple bedside procedures with the nurse. The trainee writes a brief, structured coverage note and calls the covering attending to discuss the case. Since trainees often struggle with establishing a working differential diagnosis, the trainee then watches a WISE-OnCall module specific to the clinical issues. The module provides him with a decision-making framework to approach the next clinical case he will encounter. He then receives a second page. It is another patient presenting with a similar clinical case but a different underlying cause. The student evaluates the patient, discusses immediate management with the nurse, and writes his coverage note. But not all cases are this straightforward. The third time the trainee is paged, the patient is more worrisome. The purpose of this encounter is to challenge the trainee to both recognize and manage the urgency in this situation. After seeing 3 patients, the trainee is given 15 minutes to formulate a clinical question and answer it by using online literature sources. As the trainee does this, a medical librarian is watching remotely and assessing the trainee's ability to use the literature in this way to ultimately improve patient care. The trainee then receives his 4th and final page of the night from the supervising resident. He is told to go and obtain consent from Mr. Smith for an invasive diagnostic test. The purpose of this case is to challenge the trainee to demonstrate their ability to conduct an ethical and legal informed consent conversation for an unfamiliar procedure. When he enters the patient's room, he finds that there is a second adult at the bedside. The trainee must confirm that it is appropriate to have this discussion in the presence of the second adult before respectfully and meaningfully engaging both men in this conversation.
You're comfortable discussing all this?
Yeah.
Great.
After seeing his final patient, the trainee hands off the clinical responsibility for these 4 patients to the incoming intern. The Night-OnCall finishes with a debriefing discussion of all activities that took place. We hope this Night-OnCall toolkit will be a valuable resource to educators and help to ensure that students are well prepared for residency. We believe that working together to improve education and assessment for students and residents can have a significant impact on quality of care and patient safety. Thank you.